How do we have more self-compassion in the workplace in this day and age with a heightened sense and the talks about burnout? We have a special guest with us today. My name is Dr. Elsie Coe. I'm the founder and CEO of Lead Physician Leadership Program for Physicians. We'll be talking a little bit more about that starting at the end. If you stay to the end. I'm the Chief Medical Officer of American Endovascular and Amputation Prevention. Go to our YouTube and sign up so that you can hear anytime there's a new video that comes on. We also have a whole slew of video libraries from experts in the field of leadership and well-being. I'm so grateful to be having this platform to be able to communicate this out to you. So Lead Physician is all about bringing passion, purpose, and potential back to our physicians. Who I'd like to introduce to you now, let me show you Dr. Charlotte Collins. She is a clinical health psychologist at Geisinger Health, and she graduated with a Ph.D. in psychology from the University of Kansas. And she's going to be talking to us about this whole self-compassion in the workplace. She is a clinical health psychologist, and she's helped lead efforts to integrate behavioral health into the primary and specialty care for over 10 years in the system. She's the division chief for the Center for Professionalism and Wellbeing for Geisinger. So without further ado, let me bring her on board here. Hi, Dr. Collins. Hi, Charlotte. How are you?
I'm good. Good morning.
Thank you so much for being here. This is a topic that's near and dear to so many of us. Especially physicians out there. During COVID, it's been pretty rough on top of already being rough. Tell us a little bit about how you bring this to Geisinger. Why is this so near and dear to your heart?
So we started our center before COVID, and I think that the work in healthcare is challenging, and both physically, emotionally, and mentally. And often we don't pay enough attention to the emotional part of taking care of ourselves and looking out for each other. And so we were doing lots of work here around trying to improve well-being. And then COVID hit, which really sent, I think, everybody for a loop and required us to really jump in with both feet and make sure we were checking and working with everyone in our system to be able to keep healthcare running. As you say, it's been quite a couple of years here.
Yeah, you said during the COVID pandemic, you really put out there a wide range of programs for the employees. Can you talk just a little bit about that and how that really helped improve the stress that's there?
Yeah, so it's been very interesting to try to figure out what can be helpful. We have an emergent design here at Geisinger, which means that our work is listening deeply to the people who are on the front lines, figuring out what they need, and then trying to develop programs in collaboration with them to help meet the needs of the people. We have developed a peer support program. We found out that, especially during COVID, many of our people were not even able to get away long enough to call up for a peer supporter. And so out of that, we developed some well-being navigators who are out on the floors checking on people proactively. Wow. That's been really helpful. We did a lot of presentations about stress. Many of our folks are very strong, very capable, but never had dealt with that level of intensity of emotion. And so were really a little bit overwhelmed by that and didn't really understand what was happening because they'd never felt that way before. So we did a lot of presentations around what stress does and burnout and all of those prescient topics that we needed to discuss. What I really noticed a lot in this is that people who work in healthcare are some of the most compassionate people out there. They take care of patients in very difficult situations. They came into the field because they want to help. And yet they're not very kind to themselves. And they're not, the compassion doesn't turn their way easily. They feel like they need to give it out. They see it as somehow selfish if they're putting their own needs out there in front. And so, but what we've really learned is that not only do we have to do that, but also when we do that, we give other people permission to do that. And together as a team, then we can get through tougher things than we could get through just by ourselves.
Wow, that's so awesome. Before I ask you kind of the components of self-compassion in the workplace that you recommend people focus on, can you tell us a little bit about how do we develop programs like Geisinger has? What kind of response have you had from the frontline workers when you built these programs, Charlotte? And what are the components that were the most impactful?
So we have been very appreciated and people are getting to know us. We've created a safe place where it's okay to talk about how you're doing. And I think that's critical. The other thing we've done, I think, a really good job on is really deep listening to what's happening. In the hustle bustle of everything that has to get done, sometimes it feels like leaders and leadership are not paying any attention to how people are experiencing their work. And so the issue of really deeply listening, really appreciating, making sure they know how much we appreciate what they do, and then trying to find ways that they nominate that will help them, I think has made a huge difference. People can call our center to talk to someone, and we're getting lots more calls and emails and actually, there were a lot of leaders reaching out during the pandemic because they were good managers. They were good leaders. They knew how to pull a team and work processes. They had never been in a situation where that, again, emotional intensity and exhaustion was happening, and they didn't know how to help their people. So we did a lot of coaching around how to work with your folks, how to, listen, how to be transparent, how to really help people when they got into that emotional exhaustion space, which is not a normal leadership training that most of us get. And
No, not at all. And you know what? I have a lot of respect for Geisinger. We've studied a lot of that when I was at Brown doing my executive master's in healthcare leadership. And there's a lot of process improvement that helps with the burnout too. The system, like we say, 80% of stress is related to how the system works. So I just commend you. I'm sure you were given this role because you are exceptional in what you do and what you're doing for the healthcare workers. I just want to applaud you for that, Charlotte.
thank you.
So,
We're all in it together.
yeah. So tell us a little bit about, we're talking about self-compassion in the workplace. And you told me earlier that there are three really main components to this. If you want to bring more self-compassion to the workplace, what are the three components that we need to focus on?
Well, I think we need to start by acknowledging and accepting that having emotions and having feelings around things does not make you weak. It's important to know what's going on with you and with others, because we can't really help if we're pushing everything aside. And you know what? There are times when we have to shut our emotions off. If we're doing a code, we really have to be focused on what we're doing. But those emotions don't really go away.
No.
They remain. And we have to find healthy ways of allowing that to be a part of who we are and a part of what happens to us, because it's a normal human response, right? And
Right. We can't just throw it under the rug and try to ignore it and say, you know what, I'm not supposed to be feeling this. So, I'm a physician or I'm a nurse, I'm a healthcare worker. I don't have time for this. I need to focus on others and not myself. But yeah, you're right. First is acknowledging.
And by doing that and speaking up about it, being more aware of what's happening with you, you'll notice what's happening in others. You create this environment where we are all human and we all need things that sometimes, and we can help ourselves and we can help each other. And we have to be kind to ourselves in those moments and turn that compassion inward, because we also need it just as much as anyone else does. So
it's hard to remember that we're human sometimes.
It is because we're expected to perform at a superhuman level.
Yeah.
And no more than in COVID. My goodness, that's been really at the edge of everybody's experience. And so it's been that. So I think that the irony of all of this is that the more you're aware of what's happening with you emotionally, the less overwhelmed you get by it. If you can turn that compassion, if you can say, this is what I'm feeling, it's normal to feel this way, I need to pay attention to that, I need to take care of myself in that, that actually helps us not get overwhelmed. Whereas pushing it to the side and pushing it down actually forces those emotions up in situations where we really don't want to have them and are struggling to deal with them.
Right.
So
Absolutely. It's like bottling up your emotions, and you know that everyone knows that one scary person who holds it all in, seems very calm, and all of a sudden when, the last straw happens, and then they blow up and you're just frightened. That could be,
that's right.
and that kind of reminds me of what you're saying here.
Yeah. And so that being able to turn toward ourselves, recognize our humanity, treat ourselves like we would treat someone else who we thought was suffering and struggling. That's the yin, that's the self-compassion that we know. But there's really more to self-compassion than that. Obviously, we need to be good at that, and many of us are not in healthcare. But there's also this piece of fierce self-compassion that Christian Neff talks about that I think is really important. It's especially important for women, but I think it's important for all of us to be able to stand up for ourselves, right? Protect ourselves, set boundaries, and say no, and say yes to what we really need, right?
Right.
The way that we can be kind to ourselves, but if we never put a boundary and we never stand up and say no and never protect ourselves, we're just going to get overwhelmed no matter how kind we are to ourselves if we don't stop the inflow of the stress. And so that balance of being kind and treating ourselves with compassion, along with standing up, that's also compassion, right? Standing up for yourself, making sure you're speaking out for yourself, for others. That's how we move toward changing a culture that tells us not to do any of that.
How do you kind of instruct leaders to help set boundaries like that, and help people to speak up for themselves and say, you know what, in a healthcare system where we're always on the go, it is a business, we need to get our numbers. How do we get people to say, you know what, this is where I stop?
Yeah, that's a real challenge. And I suspect that across the country, we are all facing the same staff shortages that we're facing at Geisinger.
Yep.
And so that becomes a real dialogue. And I think that leaders who are able to demonstrate and model self-compassion then allow that to open up in their people. And it's interesting because the more self-compassionate you can be, the more people see you as compassionate toward them, see you as moral, see you as a good leader. So being able to be vulnerable and say, I've been struggling, here's where I was on that, I think allows a psychological safety that we just don't have as much as we would like. And opening that up now lets you really hear what people are feeling and experiencing. And now that gives us some ways to work together. You have, as a leader, you need to be transparent in what's happening about what you can change and what you can't change, because there are things we can't change. And to think that we're just going to make a list of our demands where we're all going to say no, and that's going to work, and that the system can actually even move that way, is not realistic. But really coming together and figuring out what things we can do for each other and what things we really need to have administration above us know, and where we really need changes, I think is important. And that all starts with really good conversations and strong relationships. And I think that during this pandemic, we've lost a bit of our connectedness inside and outside of work, right? Because we've isolated, we've masked, we aren't gathering. Some of that is loosening now, but I really think that we've missed some of those tight connections, just having lunch together, having meetings together, and creating opportunities for us to really check in on how others are doing. And I'm hoping that that's coming back stronger now in ways that help us communicate and relate so that we are all in this together. We're rowing the same direction and we're fixing the things we can. And sometimes they're small things and sometimes they're bigger things that are going to take more effort. But if people see that you're listening and see that you're working toward improvements, they will usually give you some grace if you can't change everything, which of course you can.
That's really amazing. I mean, you gave us a lot of tips right there, just in this complicated question that I threw at you. But the bottom line is start with a conversation first, build that connection, allow for that feedback, let employees feel appreciated and know that you have their back, even if you don't have everything together, even if things are not changing so quickly like they want to. They know that you are thinking about them, you're listening, and you're having conversation. So thank you so much. I really appreciate you having this conversation with me today. Again, everyone, thank you everybody for listening. I'm totally grateful to have this platform to kind of talk about some of the issues we don't talk about. Again, my name is Dr. Elsie Coe. Please reach out to me at info@drelsiecoe.com if you have a topic on physician leadership that we really want to get out there. And check out leadphysician.org. We are starting a new cohort next month, and reach out to us to see if this is something that might be helpful to you or your colleagues. Again, so Charlotte, tell us, how can people reach out to you, and any last words of advice that you have for us?
Sure, you can email me. I think my emails are in here, and reach out to me. I would love to talk to other systems about what they're doing and talk more about what we're doing and how we have tried to move the needle on this very challenging problem that we all face. I would say that the first thing you need to do is just really look at how you're doing. It's really hard to help other people if you are really struggling. So look at yourself, be vulnerable, speak up. And in that way, in just that part, you're going to help so many people feel like they're not alone in what they're going through.
Gosh, thank you so much, Dr. Collins. Thank you so much, everyone. Have a happy Sunday, everyone. Thank you. Until next week.